Hey, Dr. Presley here. Now that you found a surgeon that you want to perform your hip and knee arthroplasty, what kind of questions should you ask when you meet them? So I would just start by asking just general questions about their practice, general questions about the surgery. You can ask about how many hip and knee arthroplasties do they perform each year? Are they fellowship trained in hip and knee reconstruction? To kind of get an idea if this is this the main aspect of their practice, performing hip and knee replacements. And then for the surgery in general, for hip replacements, there's multiple different approaches to the hip. There's the anterior approach, lateral approach, posterior approach. What do they recommend for you and why? What do they think is best? And same thing with the knee. There's a muscle-sparing subvastus approach, medial parapatellar approach, midvastus even, and you could talk about that. As far as techniques and technologies, do they incorporate any technologies into their practice? Anything like robotic assistance, computer navigation, anything like that? And what type of implant do they use would be a good question. So what type of implant do they recommend for you, and why do they think that implant is best? And how long do these implants last? Those are all good questions to just start off with. And there's a lot to unpack with each one of these questions. So I can break each question down moving forward and talk a little bit about each one of these questions. But until then, we'll talk later.